Hi, this is the sixth in a series of discussions I'd like to have about death and dying. And in this one, I would like to begin with a story. When I was a nurse, there was a discussion that a surgeon was having with a patient in a semi-private room. The curtain was closed, but anyway, this little old lady was hard of hearing, so he was speaking very loudly. He was trying to tell her why she needed some kind of surgery and the risks and whatnot, and he was trying to elicit her consent. And at the end of his little speech, there was this warbly voice from across the other side of the curtain where her roommate says, "Okay, doctor, you know what's right. You can do whatever you want." And at the time, I remember thinking this was hilarious. But, I've been retired. I have had time to reflect and think this is a sad state of affairs that our elderly lose the capacity in many cases to make informed decisions, and they don't have anyone to rely on to help them make those decisions. We all have the right to ask questions, and we all have the right to refuse anything. Anything that any physician wants to do, whether it's admit you to the hospital. 60 Minutes just did a segment last night about unnecessary admissions to a hospital that was trying to make a quota. And so we all have the right to question what is being done to us and the right to refuse. And as I say, the elderly need a person that they can talk to and discuss what needs to be done before they make a decision. We kind of make fun of teenagers who think they're invincible and they'll do crazy things, but none of us are willing to accept the fact that we are all going to get old. We are going to become frail and feeble, and if we live long enough, chances are we'll get demented. And that's a hard fact to face, but we need to deal with that with our elders. And even the smallest decisions can have consequences. And I'd like to tell another story. This is about an 87-year-old man who was still working, so to speak. And he was having chest pain, and his cardiologist wanted him to get on a treadmill and have a treadmill test. Well, he was 87. He had all his marbles, and he thought, no, I don't want to do this because they're going to find something wrong. His son, who was a physician, said, "You're absolutely right, Dad. Don't do this. There will absolutely be something wrong. Then they will want to fix something." And through the pressures of his physician and some of the family members who were not all on the same page, which is another important point, have the family members on the same page, he decided to have the treadmill. Of course, there was something wrong. Then the physicians convinced him to have an angiogram to evaluate the patency of his heart vessels. And of course, they were not patent. They said, "You're going to die, you're going to die, you're going to die, unless we do," at that time it was an angioplasty, where they thread a kind of like a wire and smash the plaque against the sides of the arteries to open up the artery and improve the circulation to the heart. Well, as you get older, I'm going to backtrack a minute and tell another story. When I was a small child, I remember going to a brand new park, and they had these little animal figures like a horse and a duck and something else on big fat springs. And the idea was you would sit on it and you would make it go. And I was young, the springs were new, and there was nothing I could do to make this thing wobble and do anything fun. But then when I came back as a teenager, the springs were now, 18 years old, and they were wobbling already. They couldn't stand up. The springs were old and tired. They couldn't stand up straight. You sat on that thing and it immediately started to rock. Well, that's like an older person. Their medical equilibrium is not stable. It's already off kilter, and the least little thing you do is going to change the balance, and it can cause a spiraling of events. So starting from having this treadmill, this 87-year-old had an angiogram. Well, of course, it showed blocked arteries. He went and had the angioplasty, but there is always a risk during an angioplasty that there will be problems, so that you will need an immediate open heart surgery and to repair the vessels. And of course, that happened, and it's an emergency. The person is literally crashing, and he spent a long time in the hospital, weeks in a nursing facility. He was really never the same, and that was probably the beginning of my father-in-law's dementia. This was, of course, my father-in-law, and so he was really never the same. And so the smallest little thing can cause a spiraling of events in an older person's life, because their health equilibrium is so unstable. And then 3 years later, when he was 90 years old, they wanted to do a routine colonoscopy. And it's like, oh, you've got to be kidding me. At what point do you stop doing medically invasive or somewhat routine things that are medically invasive, that have potential risks, severe risks, especially in an elderly person? Well, by that time, he and my husband said, forget it. There's absolutely no way, because even if you found a tumor, you're not going to operate on him. He's just not stable enough. So I want people to consider that anytime an older person has to make a big decision, or stay close enough to your family member, especially now that you have Skype, if you can set it up in their home with written instructions, or if they live in an assisted living, maybe you can set it up so that once a week or whatever, the assisted living people can, have that face-to-face conversation, so that you can talk things out and keep a closer relationship, so that some of these decisions can be made by elderly people are easily swayed. Like the little lady behind the curtain. Okay, whatever you say is right, doctor. You know best. And we have an opportunity to provide some balance and give it some thought, so that they do make appropriate decisions. And I think I'll hold that one for now, because I have more issues to discuss about this later, but that's it for now. I hope you have a thoughtful day.